This is the sheep heart. This side that I'm showing right here is the anterior side. And on the anterior side, you can see this diagonal line, and that's how you know which side of the heart you're looking at. On this side, you can also find the left atrium here at the flap. Once you find that flap, that is your atrium. And this is the left side. So this is the left atrium. This here is your left ventricle. And then when you turn it over, you'll find this other flap, and that here will be your right atrium. As you can also see, then your right ventricle here. We're now going to dissect the heart starting at the apex.
You can definitely feel resistance when you are cutting through this portion.
Right here gives a super good visual of the chordae tendineae. And that is all these little strings right here that help to keep that valve closed. This right here, this big, thicker area is your intraventricular septum that separates your left ventricle from your right ventricle. Also, you can see here these bands, chordae tendineae, and these are what help the valves from becoming inverted and letting a backflow of blood back into wherever it came from. And then if we look here, this right here is our mitral or bicuspid valve. And this is always connecting the left atrium to the left ventricle. Another thing you can tell is that the left ventricle has a thicker wall around it than the right ventricle does. You can tell that the right ventricle's wall is a lot thinner or skinnier than the left ventricle's wall, which is a lot thicker in comparison. Here you can see that there are also some of the chordae tendineae that make sure that the valve does not invert. But these are attaching to the tricuspid or the right AV valve. Right here, you can see this portion that I'm lifting up. That portion right there is going to be your right atrium, because just as we looked at this is our left atrium, and flipping it over to this side, this is our right atrium. Again, that little flap. This is the pulmonary trunk. This is showing me going into the left ventricle that this is the aorta here. So here, as you can see, this smaller one going through to that right ventricle is going to be a pulmonary vein. And then as you can see, this one is going through into the right ventricle. And then that would be a pulmonary artery. That completes the heart dissection lab.